So you like where you are then, Jackie?
I certainly do, because it's so makes me realise how lucky I am.
Jackie Varley was settling well into her care home. She had lived a full life, but dementia had taken over. On April the 16th, Jackie died from coronavirus. Her family couldn't get there in time to say goodbye, like so many families affected by this disease.
I'm lucky that she'd got carers with her who had known her for a long time, so I knew that they were with her. But you feel terrible that you're not able to be there. And then on the other hand, you also have to think about the fact that if you were attending, would you put yourself and your family at risk by going? So it's a no-win situation, and it's a horrible situation to be in.
Jackie's death and thousands of others reveal how devastating COVID-19 has been in care homes, where the most vulnerable in society live. Knowing this risk, in March, the government reissued guidance to social care, explaining that the NHS will seek to discharge more patients into care homes and that care homes need to be prepared. At the same time, the NHS was writing to care homes, asking them to set aside as many beds as possible so that the elderly could be transferred from wards back into care homes. But we've been told of cases where patients were discharged before they were well enough and without getting a test, potentially putting thousands of residents at risk of contracting the virus. Ali Al-Mufti owns a residential home in Wales. One of his residents was discharged after being on the same ward as suspected COVID-19 cases.
We didn't know anything about whether this lady had any issues whatsoever, any symptoms, or was carrying.
The lady's patient notes reveal why she was sent home. The ward had possible cases and that discharge had been taken off nurses as there is a drive to clear the hospital and beds.
Do you think that eagerness to clear beds put residents and other residents in those homes at risk?
1,000,000%.
Social care providers say that if they had better protective clothing and tests throughout this crisis, deaths could have been prevented.
I wonder if you will take this opportunity to apologise to those families of loved ones who died in care homes because the government didn't properly protect them.
The thing is, Nick, I think that's unreasonable as a question, actually. And I know you care an awful lot about this, but from the start, we knew that there was a very significant challenge with care homes, not least because of the frailty of the residents. It has been more difficult to get data flowing, and I'm very glad we're able to do that now on a daily basis instead of a weekly basis as before. And making sure that care homes have the support they need has been absolutely at front of mind right from the start.
Why did it take you so long to give the sector what it was crying out for, and that was tests?
Well, we have been testing in care homes right from the start and throughout the crisis. So that's one of the things in your question that I dispute. And I know the passion that you have for this subject, but it is really important for us to explain what's been going on. And we've been testing right from the start.
There was a crisis in our care homes before the pandemic. Coronavirus has exposed even more weaknesses in a system that is crying out for reform. Nick Martin, Sky News.